Hello, wish your keep healthy. Today I wanna talk about information for all of us, for young, for old, for businessmen. For what are the coronavirus symptoms? Coronavirus infects the lungs. The two main symptoms are fever or a dry cough, which can sometimes lead to breathing problems. The cough to look out for is a new, continuous cough. This means coughing a lot for more than an hour or having 3 or more coughing episodes in 24 hours. If you usually have a cough, it may be worse than usual. You have a fever if your temperature is above 37.8 C. This can make you feel warm, cold, or shivery. A sore throat, headache, and diarrhea have also been reported, and a loss of smell and taste may also be a symptom. It takes 5 days on average to start showing the symptoms, but some people will get them much later. The World Health Organization (WHO) says the incubation period lasts up to 14 days. When do people need to go to the hospital? The majority of people with coronavirus will recover after rest and pain relief, such as paracetamol. The main reason people need hospital treatment is difficulty breathing. Doctors may scan the lungs to see how badly they are affected and give support, such as oxygen or ventilation if needed. However, people should not go to A&E if they are concerned. In the UK, the NHS 111 website will guide you through what to do. If you are so breathless that you are unable to speak more than a few words, you will be told to call 999, as this is a medical emergency. If you become so ill that you've stopped doing all of your usual daily activities, then it will advise speaking to a nurse by dialing NHS 111. What happens in intensive care? Intensive care units (ICUs) are specialist wards for people who are very ill. Coronavirus patients will get oxygen support, which can involve using a face mask, or a tube in the nose. The most invasive way, for the most seriously ill patients, is ventilation, where air, with increased levels of oxygen, is pushed into the lungs via a tube in the mouth, nose, or through a small cut in the throat. What should I do if I have mild symptoms? Patients with mild symptoms should self-isolate at home for at least 7 days. People are advised not to ring NHS 111 to report their symptoms unless they are worried. They should also not go to their GP or A&E. Details for Scotland are to check NHS Inform, then ring your GP in office hours or 111 out of hours. In Wales, call NHS 111, and in Northern Ireland, call your GP. In other countries it's 911. If you have come into contact with somebody who may be infected, you may be told to self-isolate. How deadly is coronavirus? The proportion dying from the disease appears low, between 1% and 2%, but the figures are unreliable. Coronavirus death rate: what are the chances of dying? Thousands are being treated but may go on to die, so the death rate could be higher. But it may also be lower if lots of mild cases are unreported. A World Health Organization (WHO) examination of data from 56,000 patients suggests 6% become critically ill, lung failure, septic shock, organ failure, and risk of death. 14% develop severe symptoms, difficulty breathing and shortness of breath. 80% develop mild symptoms, fever and cough, and some may have pneumonia. Older people, and those with pre-existing medical conditions such as asthma, diabetes, heart disease, high blood pressure, are more likely to become severely ill. Men are at a slightly higher risk of dying from the virus than women. How do I protect myself? The best thing is regular and thorough hand washing, preferably with soap and water. Coronavirus spreads when an infected person coughs or sneezes small droplets, packed with the virus, into the air. These can be breathed in, or cause an infection if you touch a surface they have landed on, then your eyes, nose or mouth. So, coughing and sneezing into tissues, not touching your face with unwashed hands, and avoiding close contact with infected people are important. People will be most infectious when they have symptoms, but some may spread the virus even before they are sick. Face masks do not provide effective protection, according to medical experts. However, the WHO is re-examining whether the public might benefit from using them. In the next vlog article of our live Coronavirus Stats YouTube 24/7 stream channel, with all statistics by all the countries, we will post more extremely useful information.